Civil society groups Section 27 and the Cancer Alliance are accusing the Gauteng Health Department of dragging its feet over the outsourcing of radiation oncology services and surgical backlogs. They say the Gauteng Treasury has made 784 million rand available, but so far there's been no progress. Khanyisa Mapipa is an attorney at Section 27. Khanyisa, good evening to you and thank you for your time on the Pulse tonight. As I understand it, this money is available. Patients who would normally go to Gauteng Health hospitals are allowed to then use this money to go to other hospitals. What's the hold-up?
Hi, Stephen. Thank you so much for having us. So this agreement was arranged with the Department of Treasury and the Department of Health back in the beginning of the year, and the allotment of the money was made in March. From our understanding, from our meeting with the Department of Health late March, the Department of Health was meant to follow a three-step process, which was to update the waiting list, and then following that, create a criteria by which it would assign patients to the private sector, and then appoint a private sector provider who would then provide the radiation oncology services. From our standpoint, it is unclear why this hasn't been done as yet, or why that the service provider has not been allocated or has not been appointed.
Has there been any explanation for the delay? 3 months when it comes to oncology is a very long time.
It is a very long time, Stephen, and you know, we've been trying to meet with the department time and time again since the 27th of March, and we met with them the last time we met on the 2nd of June. At that point, they indicated to us that they were willing to then discuss undertakings and deadlines with us. From that point, it was decided at the meeting that by the 9th of June, which was this past Friday, they would have received a deviation from the normal tender processes, which is a completely legal process that was used in COVID-19 to expedite the procurement of services. Thereafter, they would meet with potential service providers within the private sector, and that the second deadline would then be on the 23rd of June. Following that, they would allow the private healthcare providers to provide them with proposals, and that deadline would be on the 7th of July. And following that, they would make an appointment by the 21st of July. Our concern is that the fact that they haven't met now yet the deadline for 9 June, which was to provide us with a deviation, or at least to confirm that they've received a deviation from the normal tender processes, means that they will push out essentially the deadlines that they have created for themselves in the next 2 months, and which means that cancer patients will again not see the treatment that they need as early August, which is what the department has undertaken.
So Khanyisa, I mean, for some patients, this must mean that they're not going to get their treatment in time. I mean, they could literally risk losing their lives because some bureaucrat in the Gauteng Health Department isn't doing what they're supposed to do.
Yes, that's completely what it means. I mean, at the beginning of this process, we had been instructed by the Cancer Alliance to litigate on this matter. But through the advice of counsel and our advice, we had advised that perhaps a better solution would be to negotiate with the Department of Health as well as the Department of Treasury, which we did and which was successful. And what that essentially meant was that it created hope for people who were our clients at that point, who wanted us to litigate on their behalf, who have been waiting for these services for now 2 years. And as you've mentioned, Stephen, cancer is not something that can wait, and especially that can wait for over 2 years for such essential services. And so, you know, some of these people have experienced recurrences. These are clients that we have spoken to, that we represent, who have experienced numerous recurrences of their cancer and yet are still waiting to receive these services.
Khanyisa Mapipa, thank you, an attorney at Section 27.